Well, autism's a range of conditions, and they're characterised by children and young people who have difficulties in social interaction, difficulties in communicating, and then sort of rigid and repetitive ways of thinking and behaving. And when you see that constellation of sort of symptoms in a child or young person, that's when the diagnosis of autism would be relevant. It's more recognised now than it was, 10 or 15 years ago. So more children now would get a diagnosis of autism than they have historically. And we think that's because there's better understanding and better recognition of the range of children and young people who would meet a diagnosis of autism. So one of the important things to understand about autism is not every child with autism will present in the same way. So you can range from children who have a significant learning difficulties and need a lot of support, to children who can be in mainstream school and be doing very well but still have autism. Our group's been involved in research looking at early screening and diagnosis, and one of the things in the 25 years that I've been working in the field is more and more children get a diagnosis at a much younger age than used to be the case. So more and more children get diagnosed in the preschool years, and that's partly due to research programs, including those that we've been involved in. If families want advice and want to discuss with someone, I think the first port of call would be a GP, but then usually it would be being referred to a consultant paediatrician or a consultant psychiatrist, and they're usually the experts whose teams are involved in assessment and a diagnosis of autism. And then there are some very good organisations in the UK, for example, the National Autistic Society. They have contact helplines, they have lots of information, and families can get advice about where to go from organisations like the NAS. So we know more and more about what works for young children with autism, and services in SLAM and in other parts of London are trying to develop new services to meet those needs. So thinking about intervening with parents, intervening with the children and young people, working in partnership with schools and other services to provide interventions that support and help children with autism and their parents manage their behaviour and develop.